being an acupuncturist, I always go towards acupressure, and acupressure can be really helpful. So what acupuncture points or acupressure points can we use to help? So let's think about some of the things we're talking about. So stress is one of the major ones, stress and anxiety at this moment. So we can use one of the acupuncture points that you probably may or may not have had used on yourself in clinic or when you visited the acupuncturist, and it's called Li4. And in this case, it does quite a few different things, but in this case, we're going to use it for stress. So where is it? Okay. So if you get your hand, pinch your hand together, we're looking here for the end of the crease here of where your thumb is, and we're just going over a little bit towards this bone here. Okay, I'm not going to do names of bones or anything, it's not important at the moment. So bottom of that crease there and going across to here. So this can be done from a standing position by just simply crossing your hands like this, finding that area here, so together again, here, and just going in there and press and rotate. And rotate until it just hurts a little bit, and just do that for just a few minutes, and then stop and swap over. Now you could add this to your walk if you wanted. When you stop and do your exercises like I've just shown you, you can hold your hands here and just simply do it as you stood. Very, very easy. While you're doing this, you can incorporate a little bit of breathing techniques. Make sure again that those shoulders are not up. Your shoulders are not up by your ears, and just do that. So that's one exercise that's one acupressure point for stress. Okay, so stress. Where do we get stress? People get it in different places. People react differently to it. I always get it in my neck and my shoulders. To be fair, I get it in my stomach a little bit too. A little bit of a nervy stomach. That one I've just showed you might help with that a little bit too. But the ones on the neck, you've got some acupressure points here. I'm going to show you a diagram of this, but if I just turn my head here. So if you just go back to the back of the neck here, you'll see sort of roughly, and I'm not going to go into proper locations here, but roughly, if you get the ear and the midline here, the centre of your neck at the back, and just go halfway, and where the skull sort of finishes, you want to be going in and under there, and pressing upwards in this direction, using your thumb in this manner. So going in and up and pressing, and again going in, rotating, so you feel that slight dull ache. And you can do this from both sides like this. Okay, just go in, and you find that this is something that we do anyway when we get headaches, but go in and just rotate. And it's that sort of quite pleasurable pain that you get from it. And just rotate. Now, some of us have also struggled with sleep. I know I have. So if we take that a little bit further and go just a little bit further now, about an inch towards the ears, there is another acupressure point here that may or may not be tender. Do exactly the same. This will help, or should help, to aid with sleep. So in, up, under, quite pressure. Go for that dull pain. Rotate and hold. And again, like I said, you can use both hands. You can do it from here. So you can do that whole area at the back of the head. Lovely. Okay. Oh, that's good. Okay, and then we've got another one that works on the shoulders. That will work on the neck and the shoulders. Good for headaches, good for lowering your stress levels. And another one next to it that's a little bit more towards the ear. Very good to help with your sleep. But we've got another one. So if you go to the shoulder and the neck, approximately halfway, maybe just a little bit closer to the neck, we've got another point here. So we can go into it, and that's on the top. If you go, you'll feel that's tight. And if you go into that muscle there and press, you'll feel it. So you can do that on both sides too. Okay, great if you can get somebody else to do it for you, but in these self-isolation, better do it yourself. So just go in and press. I find, to be honest, it's better doing one of these at a time. It's a little bit difficult to do both. Okay, going, oh yeah. So right in there, and we're still doing that rotation movement. round and round, quite deep, hooking right in and going quite deep. And the same on this side. Okay, you might get a crack out your neck there. Oh, there we go. Okay, always good for these, just some shrugs as well, forward and back. Oh, some cracking going on there. Just trying to loosen that up a little bit. Okay, so there is some certain acupuncture points to use to sort of, in a roundabout way, help boost the immune system. So I'm going to show you some on the leg in a minute, but I'm going to do the ones that are easy to get to here. These ones help to boost the immune system, are particularly good for opening and clearing the chest, which, as we know, with coronavirus being the way it is, this is something that I think would be good to work on. So if we go, take the midsection here, so you've got your Adam's apple, and just come down a little bit. Okay, just come down a little bit to here. Okay, you've got your collarbone, and I want you to go approximately 2 inches below the collarbone. And you're looking for a space between the ribs. It's called the intercostal space, but that doesn't really matter at the moment. And I want you to play about. So it's about play about, and I want you to push inwards towards the core. Okay, and you will find a tender spot. This is called kidney 26. You can use the one above, kidney 27 as well, which is directly under the collarbone. But go in here and just press in towards that core, and just press in and rotate, and it again will be a little bit painful. Okay, so just massage that. This will help to open the chest, so this will help you to expand your chest, get a good deep breath of air. It's also calming as well. It's very calming, good for your emotions. So press in, and on some of you this may be tender. It's tender on me. Okay. Now using this point is good to open and clear that chest. Help you get a good breath of air. You can do that one. You can do the one above. You can even go a little bit further down. You'll feel the painful areas, and you can see roughly where it is, where I'm going here. Okay. In conjunction with that, we can use one of the acupressure lung points. Some of the recent videos I've been watching tends to use one of the points called lung 9, but I actually prefer lung 7. So what we're looking at is, we're not going to go into terminology here, but we're coming down from the thumb and we're getting that lumpy bone now on the wrist bone. So I want you to go this side of the wrist bone, the elbow side of the wrist bone, right on the top, and I want you to get your thumb and press into there, and again rotate. Again, it's right at the base of the end of that knobbly bone. Okay, so you've got the rise of the bone there, and where it comes back, it's right in there. So I want you to just go in, press and rotate, and again, it should be a little bit sore. There's a couple of tendons there. You may or not be able to feel those. If you can, you want to be between them. Okay, so it's the head of the bone, elbow side of the head of the bone, so the bone coming down from the thumb. You've got the bone here, and then you've got the acupressure point, and it's right on the top there, and it's between two tendons. Go in, deep, press. Again, a little bit of pain helps to make it work, and you'll feel that dull ache, and rotate. And you can do that on both sides, obviously. That will work in conjunction with this, and again, will help to open that chest. Okay. We're going to do stomach 36. Now this is a point that's used a lot in acupuncture. It's an empirical point, and it's on the leg. So I'm going to try and show you where that is now. Okay, this is maybe not that easy. Let's have a look. Okay, so I'm just going to move the camera here. Okay, so here we go. So, I don't know if you can see that very well here. Okay, so there's the kneecap. There's the bottom of the kneecap. I want you to get your hand, and one full width of your hand, I want you to measure down from the kneecap. So, butt up against the kneecap. Hope you can see that, okay? Butt up against the kneecap. And make a mark with the other hand here, and hold it. Okay, now I want you to be on the tibia here. This is the shin bone. Okay? Find the top of the shin bone where you have, and one finger width from that to the side here is the point. go in. I want you to hook your thumb like this and press in. Press in there and go as deep as you can and press. And do that rotation movement, press and hold. Okay, and you should be able to, again, you should be able to feel this. Okay, so I'm just going to do that again for you. So kneecap, the outside of the leg, the lateral side of the leg. So the kneecap, find the bottom of the kneecap, one full hand width down from the kneecap. Place your other finger on, make a mark there, hold it, right on the tibia, on the shin bone. Okay, measure 1 finger's width from that mark, 1 finger's width to here. Press in with the hook and rotate and press deep. Okay. So, how long do we do this for? Well, I would do it for a few minutes. Do it for a few minutes. You do it for a few minutes and then rest and then do it again. You can do it for as long as little as you want, really, but you have to do it enough to make it work. So I'd say probably 3-5 minutes. Take a break and then do it again. And you can rotate yourself around doing different ones for what you're trying to achieve. All these wouldn't be bad ones to do. Okay. Another one is the temples. Always good to massage the temples here. Just to, especially relaxing. Rotation, and these are some ones that you would do normally without even knowing anything about acupuncture. When you've got headaches and things, you go straight to here, or you go into here and you massage here, you know, get in and shrug. Okay, so that's about it for now with the acupressure. I hope some of these tips have been useful for you. Try them, and go from there. But the main thing at the moment is keep calm. It's a difficult time for everybody. You're not in this by yourself. We're in it together. So keep calm, keep taking those walks, keep self-isolating, and see you on the other side. Okay, bye.